The coronary circulation. The coronary arteries arise from the aorta, ascending aorta, just below the aortic valve cusp. The right coronary artery arises from the right aortic sinus and the left from the left aortic sinus. Nothing arises from the posterior aortic sinus. The arch of aorta starts from the ascending aorta in the right second intercostal space and goes upwards and backwards in front of the trachea and then goes down to end at the fourth thoracic vertebra where it becomes the descending aorta. The only branches of arch of aorta are: on the right side is the brachiocephalic trunk, which divides into the right subclavian and right common carotid arteries, and on the left side gives the right common carotid and right subclavian arteries. The coronary circulation occurs during the diastole, not during the systole. The right coronary arteries runs in the coronary sulcus and supplies the right atrium and the front of the right ventricle, and then at the inferior border it gives off a marginal branch and winds round to go on the posterior surface of the heart, where it anastomoses with the branches of the left common carotid artery and the circumflex artery. The left coronary artery, which arises from the left aortic sinus, it divides immediately into the circumflex artery and the left descending branch, which supplies to the right ventricle and left ventricle and the anterior part of the interventricular septum. The circumflex artery follows the coronary sulcus and posteriorly and supplies the left atrium and the posterior surface of the left ventricle, and at the inferior border it branches into the marginal artery. So the right coronary artery goes to the back and the left anterior descending branch goes to the back and the marginal and the anastomose at the back of the heart. The septum, the interventricular septum, anteriorly is supplied by the left anterior descending branch of the left coronary artery, and posteriorly it is supplied by the right coronary artery branch, the posterior coronary artery, posterior interventricular artery. So the right atrium is supplied by the right coronary artery, and the right ventricle is supplied anteriorly by the right coronary artery and posteriorly by the left coronary artery. The left atrium is supplied by the circumflex artery, which is a branch of the left common carotid artery. The left ventricle is supplied by left anterior descending branch that supplies the anterior and inferior surface. The left ventricular posterior surface is supplied by the right coronary artery, and the left ventricular lateral side is supplied by the circumflex artery, which is a branch of the left coronary artery. The septum anterior surface is supplied by the left anterior descending branch of the left coronary artery, and the posterior surface is supplied by the right coronary artery. The venous drainage of the heart. The coronary sinus, it runs in the atrioventricular groove on the posterior surface of the heart and opens in the right atrium below the openings of the inferior vena cava and right atrioventricular orifice. Opening into the coronary sinuses are the small cardiac vein, the middle cardiac vein, the great cardiac vein, and the oblique cardiac vein. The opening of the coronary sinus into the right atrium is guarded by a valve that is known as Thebesian valve. The anterior cardiac veins, they do not open in the coronary sinus. The anterior cardiac vein open directly into the right atrium. And also the smallest cardiac vein, they open directly into the heart chambers. The oxygen consumption of the heart. The heart has a high basal oxygen consumption. It's 8 to 10 milliliter of oxygen per minute per 100 gram. And it has a highest arteriovenous oxygen difference, which is about 10 to 13 milliliter per 100 ml of oxygen. The factor contributing to the supply of myocytes, the high aortic pressure that causes autoregulation. Number 2, the high capillary to myocyte ratio, many capillaries around a myocyte. The short distance diffusion. Number 4, alpha 1 receptors first cause vasoconstriction and then beta 1 receptor cause vasodilatation that increases the coronary blood flow. Number 6, the vagus nerve, the 10th cranial nerve, that causes vasodilatation and decreases the heart rate. And the mediators for the heart are adenosine, that helps in autoregulation and causes hyperemia and vasodilatation. Adenosine is a coupler of oxygen consumption and coronary flow. Nitrous oxide also regulates the coronary flow. The nervous control of the heart. The central control of the heart is in the medulla. It has two centers, an inhibitory center and an acceleratory center. The inhibitory center sends the vagus nerve, which is parasympathetic nerve, and the acceleratory center sends it to the spinal cord, and from there on the sympathetic nerves from thoracic 1 to thoracic 5, they supply to the sympathetic ganglion, and from the sympathetic ganglion the nerve fibers goes to the heart. The vagus nerve, which is parasympathetic, is inhibitory to the heart, and it supplies the SA node and the AV nodes. The sympathetic system, it also supplies to the SA node and AV node, and it also supplies the musculature of the heart. The vagus sympathetic nerve, which is inhibitory to the heart, supplies the SA node, AV nodes and the coronary artery, and the sympathetic supplies SA node, AV nodes, coronary arteries and the heart muscles as well. What is parasympathetic nervous system? The parasympathetic nervous system has a craniosacral outflow, a cranial and a sacral. The cranial outflow has a 3rd, 7th, 9th and 10th cranial nerve. The 3rd cranial nerve, the oculomotor nerve, relays in the ciliary ganglion and supplies to the ciliary muscle of the iris and the sphincter pupillae. The 7th cranial nerve, or the facial nerve, relays in the pterygopalatine ganglion, and the postganglionic fibers supply the lacrimal gland and the mucus gland in the nose. The facial nerve has a second relay in the submandibular ganglion, and the postganglionic fibers from the submandibular gland supply the submandibular and sublingual salivary glands. The ninth cranial nerve, the glossopharyngeal nerve, relays in the otic ganglion, and the postganglionic fibers supply the parotid gland. So the salivary glands have two types of nerve supply. The ninth nerve supply the parotid gland, and the seventh nerve supply the submandibular and the sublingual glands. The seventh nerve also supplies the postganglionic fiber through the pterygopalatine ganglion